I've seen war, bushfires, floods.
My husband wasn't always kind to me. He hit me and yelled at me.
My father, Giuseppe, doesn't speak much English now due to his dementia. And bad things happened to him as a child.
When I fell in love with a woman, my family threw me out on the street.
Most older Australians will have experienced at least one trauma in their lifetime. This means that somebody you love or care for is likely to have experienced trauma. Lots of different kinds of events can be experienced as traumatic. And for older Australians, moving into aged care can also be traumatic and lead to feelings of loss and grief. While many people will recover, for some the effects will be long-lasting and result in mental health problems. These problems may include anxiety, anger, depression, substance use, or post-traumatic stress disorder. One of the most important things you can do is ask yourself what's happened to this person. Why might they be thinking, feeling, or acting this way? Reminding yourself that this person may have experienced trauma helps you understand their needs. Behaviours that appear challenging, like being irritable or staying away from people and not communicating, may be the person's best attempts to cope with distress or reminders of trauma. There are also practical things you can do to help. Listen to their story, but don't force them to talk. If a person feels safe and comfortable with you, sharing their story can help them feel understood and make sense of what happened to them. Stay in touch. Even if you can't visit regularly, call them or keep in contact in other ways. Encourage them to make friends. Suggest that they join a group or go on an organised outing. Help them keep to a routine and do things they enjoy. Point out their strengths and what they've achieved in the past. And most importantly, explain that they're not a burden. They don't need to feel guilty about asking for help. By doing small things, you can improve the quality of life of people who've experienced trauma or who might be feeling sadness, loss, or grief.